Hello, everyone. I am here with the man, the myth, the legend, Dr. Schultz, who is a leader in stem cells and other injection-based therapies. So for those of you who don't know, Dr. Schultz is a board-certified anesthesiology and pain medicine doctor. He completed 2 fellowship trainings at the University of Pennsylvania in pediatric anesthesiology. And is this the Wake Forest University Pain Clinic?
Yeah, it was Wake Forest University, the Fellowship in Pain Management, specifically interventional pain, how to inject
Awesome.
things with needles.
Yeah, and so now Dr. Schultz is working with Regenexx at the Centeno Schultz Clinic, pioneering some really cool procedures. But before we talk about one of the latest developments, the PICL procedure, I had a quick question. What motivated you to change direction? Because I know you previously were working in narcotics and pain
Yep.
management. What motivated you to change from that to working into more interventional orthopedic care?
Yeah. So first and foremost, thank you for this opportunity. And for your listeners, thank you so much for taking time to listen. This is such an explosive field, and there's not, everyone's not congruent, and not everyone is transparent. So thank you, everyone. To your point, Dr. Centeno and I had a very successful pain practice where we burned nerves, we gave steroid injections, and we had oral medications in the form of narcotics and muscle relaxants. It was a very successful, booming practice. But at the end of the day, Alex, you know what the problem was? Is intuitively at night, we knew it didn't work. Those very same patients came back cycling again, every month, every 2 months. So these were short-term profits that were not with the best intentions for the patients. And at the same time, it all kind of coalesced. That's to say, there was a huge article that came out in 2005. It was groundbreaking, and it demonstrated the regeneration of the disc in the animal model with stem cells. And that's what launched us into the next phase of our careers, of our passions, of our life. How to do things to save patients from surgery.
So I think it's safe to say that you are an expert when it comes to stem cells. I mean, between you and the doctors you've trained, there's thousands, if not tens of thousands of procedures that have been done over the past decade. Does that sound about right to you?
Yeah, so Regenexx came out of Centeno Schultz. It was the birth product of Dr. Centeno, and Centeno Schultz Clinic is the headquarters. It's the training ground for every Regenexx provider. They come to Colorado, and we've had the privilege of training them.
So Regenexx is the headquarters. It's where all the heavy duty, gnarly cases and latest developments are seen, right?
Well, that's where Centeno Schultz is really the place where it all is. So in terms of clinical, in terms of getting treatment, in terms of groundbreaking techniques like the anterior cruciate ligament, that procedure was developed at Centeno Schultz Clinic. We mastered that, and now we're into the thousands, saving patients from having needless anterior cruciate ligament surgery.
So I want to talk about one of the latest procedures that is in,
Sure.
I don't know if the clinical trial is still in development. It's the PICL procedure. It's the procedure that I've had done 4 times now. And I think if I can't say it didn't change my life or save my life, it radically changed my outlook on life because I was close to bedridden. I mean, I would get up and go to work, but I could hardly, walk around the block without having debilitating vertigo, blurred vision, and other neurological symptoms. And I'm so glad that I lucked out and was introduced to the Centeno Schultz Clinic and was a part of the clinical trial for the PICL procedure. But I was wondering if you could give listeners a brief introduction to what the PICL procedure is. What is it, and what is it used for, and how did it come about?
Sure. So as a result of our many years of practice, we have dealt extensively with patients that have had car accidents, other forms of trauma. And we've always been very attuned and compassionate to these patients. And many times they had symptoms that didn't quite fit all the boxes. And they didn't have imaging studies that gave answers. So in 2015, we developed a groundbreaking technique whereby the ligaments that connect basically your head to your neck can be repaired utilizing your own stem cells. So if we back up for a minute, it's hard to believe, but there are 2 or 3 ligaments that hold the head to the neck. That's it. And this bowling ball is kind of heavy. And these ligaments can be injured. And we've looked at it, and basically there are 2 groups of patients that have injuries to this. There's those that have had traumatic injuries, either from car accidents, mountain biking, skiing, or from high velocity adjustments. That's one group. They're the traumatic injury. And then on the other hand, they're this group of patients that have congenital problems with their ligaments. These patients have hypermobility, and some of them have what's called EDS, Ehlers-Danlos syndrome. And for those listeners that don't know that, basically the ligament which connects bone to bone is very stretchy. So these patients have some of the symptoms of the same patients that have had traumatic injuries. And so these ligaments that hold the head to the neck can be injured, either as a result of congenital problems with the ligaments or trauma. And these can be profound or mild or moderate. But most importantly, all these problems make sense when you understand that there's compression of the brainstem, there's compression of some of the exiting nerves, and most importantly, if I can't tell you and your listeners this, so many people get shamed by their doctors that come in that have cranial cervical instability. They actually say that it's in your head, that you're a malingerer, that you're trying to get secondary gain. Well, we're here to tell you that it may be in your head, but it's as a result of the injury to the ligaments. And we want to help you. And there is help now. So the PICL procedure is an injection of your own stem cells through the back of the mouth under X-ray guidance to repair and heal the damaged ligaments. And in doing so, to get your life back on track, to improve some of the symptoms that for the most part have kept patients bedridden, housebound, not engaged in life, not involved with family members in church and community. That's our singular goal.
So why hasn't this been done before? What makes this so special? Because stem cells have been around for a long time. What makes this procedure so unique from typical stem cell injections?
Yeah. Well, look, can I just go back here one step? So the treatment for cranial cervical instability prior to 2015 was twofold. You either ignore it and you're bedridden and isolated, or number 2, you have surgery. And the surgery takes the form of a bolt with hardware going from the back of your head down to your neck. So that's known as a fusion. So that was the standard of care. In 2015, my partner devised a technique whereby we could put a needle through the back of the mouth, through the cervical spine, adjacent to the spinal cord. Now, everything that led up to us in our life allowed us to have precision, and I mean precision control of the needles. The procedure that we have is only performed in Broomfield, Colorado. It's only performed by Dr. Centeno and I. It's been the 30 years of practice that has enabled us to have that expertise to do that. And now we've exceeded our own expectations. We're thrilled. We've had almost 260 cases over the last 5 years.
Wow, 260. I'm sure many of them have been having great results. So tell me a little bit about the results that you've been seeing, because I know that you've been doing some research on this patient population as well, right?
Absolutely. So the short of it is most patients have had a significant improvement in their symptoms. And the most common symptoms are headaches, vertigo, and this brain fog where you feel like you've taken Benadryl or you drank too much Cuervo the night before and you just can't get it engaged. And I can say uniformly, these patients have had improvement. Now, on the same hand, I can tell you that most patients require more than one injection. So that's the short of it. We've seen clinical improvement from a single injection.
And I think the way that you diagnose the craniocervical instability has changed over time as well, right?
It has. We now have been utilizing a whole constellation of symptoms. First of all, is you have to have the symptoms, you have to have exhausted conservative care, and you have to have imaging. And that, regrettably, unfortunately, is not available in all the communities. We use a dedicated MRI for the alar and transverse ligament, and if that's not available, we use what's called a digital motion X-ray. And Dr. Katz here in Boulder and Denver does a fantastic job.
So can you see the alar and accessory ligaments on an MRI? Because I think there's some controversy over that for a while, right?
Yeah, so here's the problem. So for everyone that's listening, the alar and transverse ligament are at the C12 level. Regrettably, most MRIs of the cervical spine stop at C2. So in a traditional MRI, you will not see any images of the alar or transverse ligament. However, in Denver, Colorado, and in some places in New York, you can have a specific MRI that looks at the alar and transverse ligament.
So you mentioned a couple of boxes that had to be checked, right? So diagnostic imaging as well as exhausting conservative treatment. So what does a patient who is really a good fit for this procedure look like, and what does exhausting conservative treatment mean?
Sure. So they have to have obviously some major symptoms. And as I said previously, headache, vertigo, balance disorder, and functional compromise. Going from a high level functioning individual to someone that has trouble even doing domestic chores. That's the first and foremost. Number two, in terms of conservative care, not every headache comes from an alar injury, right? We have to have, within reason, some evaluation and workup of headaches and vertigo and balance problems, because again, they're not always from the alar and transverse ligament. So conservative care, physical therapy, dry needling. For those patients, we need to have an MRI of the cervical spine, at a minimum, an X-ray. In many places throughout the nation, you can have diagnostic facet injections for headaches at the 2-3 joint, the 3-4 joint, because again, the simple stuff in many cases helps patients with headaches. If you've had the conservative some chiropractic care, some massage, you've had dry needling, you've had a series of diagnostic facet injections with no clear benefit, and you have the symptoms of the headache, the vertigo, the balance problems, and the dysfunction, and you have some imaging, some MRI that's specific to the alar or transverse ligament or a DMX, those are the people that need to start thinking about, hey, do I have some instability? And if you don't have a DMX, it's okay. I would rather have someone have a telephone candidacy with us. We do those every day, Monday through Friday, where myself or my partner gets on the phone, we talk with the patient. I'd rather have that discussion and bring you to Denver and have the DMX than have a DMX in a community where it's really substandard, which has
Right.
been sort of the norm Regrettably, it's like someone's doing it, but they're not making accurate measurements, or they're not in proper alignment. And guess what? Then the patient has to do the procedure again, and that's an additional cost.
Yep, we did a whole video on this with Dr. Katz talking about
Oh,
the
you did?
issues with typical DMXs, and it's a huge problem with a lot of communities just not either having access to a DMX at all, or the images being blurry, or not even being focused in the right area of the spine. It's crazy how non-standardized that scan can be.
Well, since we're on it, I also want to talk about non-standardization of injections. There are providers throughout the nation that are doing, quote, facet injections into the cervical spine, and they're actually using X-ray, or at least there's X-ray in the room, but they're not using contrast. So contrast, Alex, is basically a dye. Once we put a needle into a designated spot, we inject contrast to confirm that that's where our needle is. We do that for the best clinical results. Can I put a needle over a joint and take a picture and call it good? Yes. But the only way to tell that a needle is specifically in a joint is to put contrast in it. And there's several providers throughout the nation that refuse to use it because they're not probably injecting the right areas. And I just need to forewarn all the listeners, before you have that cervical facet injection, before you have any injection, make sure that you can, number one, have a copy of the images, and they are using contrast. Because if they're not, it's not worth doing the procedure.
They could be injecting and missing the ligament or the area entirely, right?
Completely. And there's someone particularly in the southern part of the United States that this happens on a daily basis.
Right, right. No, won't name anyone. So tell me, what general guidance would you give to someone who believes that they have upper cervical instability? Maybe it could be tips for day-to-day living, or management of symptoms. What have you seen that helps, or some direction that you could give them?
Yeah, number one, again, your symptoms are legitimate. Please don't be shamed or beaten down or embarrassed by these, okay? In 2020, there is help. That's the take-home message. Number two, if you're having a series of procedures or injections or treatments that aren't working, simply stop. Number three, be aware of your posture, be aware of the things that trigger your symptoms, and stop them. Engage or allow other people in your life to help you minimize the symptoms. Number four, try to get some support, either a collar temporarily or some posture improvement, even putting your head up against the wall, just to get a sense of what it feels like. And number five, get a telephone consultation with us. Let's stop the agony. Let's get you better, because suffering is optional. There's going to be pain in this life, but you don't have to suffer needlessly.
Absolutely. And you don't have to get a spine fusion either, which is crazy. I think that was the only option that I had. It's that or nothing else. Yeah.
And truthfully, and I know you know it, but for those people listening, for every fusion, that's not the end of the journey. There's a process called adjacent segment disease, ASD, you may hear us talk about or read about, but the long and short of it is that level that's fused is now immobilized and it can't absorb the forces of daily living. And as a result, the levels below it and above it are going to take a beating. So in a couple of years, they break down, and guess what? Now the fusion has to be extended. And then the whole cycle starts again. And it's terrible. So there is hope. There are non-surgical, effective treatment options. And to that extent, you touched on it earlier, and I just want to reach out and tell all the viewers that COVID has taken our breath away. COVID has impacted everyone's business, ours included. And so for a short period, we did stop all studies, but we're now back on track because we believe that this community deserves to be supported. And to that, we have started back our CCI study. This is a study that is free of charge. It is a very vigorous study. It includes being enrolled, and you may get what's called a placebo or no injection of actual cells. You'll have 2 of those, and then if it doesn't work, we'll crush you over. So we are engaged, we hear the community at large, and we're in.
And so patients don't have to be a part of the clinical trial in order to get this injection, correct? That's an option that if they're qualified for the study, and I know there's a lot of qualification material because I was actually a part of it, and I was just praying, said, please God, I don't want the placebo. And 2 months after the injection, I said, if they told me that they gave me the placebo, I told them they're lying because it was just such a stark difference in my symptoms. But yeah, is it required to be part of the clinical trial?
Absolutely not. Not everyone has the means or the opportunity to do it, so we've availed this opportunity to our patients. Now, to participate, you need to fall in the inclusion criteria, and it's a pretty strict inclusion because we intend on publishing this information for the world at large, for those patients that suffer.
And you all have published a lot of research in clinical trial work, stem cells, I think more than any other clinic on planet Earth. Is that right?
Yeah, it depends which day of the week it is, but we have collectively 43% of all the published literature in the world. And this is really part of our commitment. If you want to push this rock uphill, if you want to be credible, if you want to be acknowledged throughout the world and make a difference, not only do you have to provide this care, but you have to publish and you have to teach. So that's our commitment to the world at large, because we believe and know this makes a difference, that stem cells allows your own body to heal its injuries.
So where can listeners go to inquire about the clinical trial or about the procedure or to get the ball rolling?
Sure. So Centennial Schultz Clinic, that's a place that you can email us. There's the contact us, am I a candidate form. And then the second website is the CCJ Institute, which is another website under that. You can use am I a candidate and give us that information. And then our staff will reach out to you in a timely fashion to get the ball rolling.
And I'll include a link to that in the video description
Perfect.
below. Well, thank you, Dr. Schultz. I hope to see you again. Is there anything else that you want to add before we wrap things up?
Well, I just want to thank you, and I want to share with your listeners that you are a different man. You are a different man in terms of your stature, in terms of the vibrant man you are, even your eyes from the first time I met you. Tragedy sometimes happens, injuries occur, but there is hope. So in 2020, through stem cell injections, we can make a difference. We're here, we do telephone candidacies, and I just want to thank you for this opportunity.
Well, thank you. I mean, I'm so lucky that I was introduced. I mean, it was just a total, totally by accident. I was working with a NUCA chiropractor who was working with Dr. Rosa, who knew Dr. Centeno, and I just sort of through the grapevine said, "Oh, you should go talk to the guys at Centeno Schultz. Like they're doing this upper cervical thing. It seems like it might actually be for you." And wow, it's just divine intervention right there. Totally random, totally lucky, but I'm so glad it happens. Well, thank you, Dr. Schultz. I really appreciate your time, and I hope to have you on maybe another time for a Q&A with the community. There's a lot of questions out there.
Would love that, because the more you know, the more the readers know, the more that the patients know, the better. Because we're all in this, and if we can spread the word, all the better. Because again, pain is inevitable in this life, but suffering does not have to occur. Have everyone a very safe, restful, and peaceful holiday.
Thanks, Dr. Schultz.
Thank you.